Hello, everybody. Tonight we are going to be discussing the recent visit that Roxanne and I had to the AAFCO meetings in San Antonio, Texas. There were a couple of things that were really interesting, and we are going to discuss those over a couple different videos. This one in particular, we wanted to talk primarily about copper. And this is kind of a baseline of things that we've noticed as a consistent issue in multiple areas, but there's so much information on copper, so much focus on copper, that we wanted to really have that conversation with everybody and understanding like where laboratory analysis is and isn't going well in this industry, how it's beneficial, how it's harmful, how it's affecting your pets, and what we feel about how it influences fresh feeding in particular. So I am actually going to let you take it away, Roxanne.
Yeah, thank you, Chelsea. Yeah, it's always enlightening to attend the AAFCO meetings, and I'll just say, up front, as raw food manufacturers, although we don't always see eye to eye with AAFCO, and we feel there are limitations with what they provide in the OP, it's important to attend these meetings because it is the arena that we need to operate within. So I think it's important to attend, even though we do things quite differently, so that as a raw food manufacturer, instead of just saying, well, that's AAFCO and that doesn't apply to us, or it actually does. And with how we have to register in each state and what the requirements are, I feel that it is our responsibility as a manufacturer to know what the requirements are, and it educates us also on knowing the limitations that might be going on within AAFCO and because like Chelsea and I were speaking earlier, and if we didn't attend these meetings and it was just in the form of this book, which is the 2023, this is the official OP, so all of the information's in here. But if I didn't attend a meeting and I just looked at the profiles in here as a manufacturer, with the caveat that I just have to meet those profiles and my food is complete and balanced, I wouldn't know the discussions, the science behind it, the reviews, the literature, the expert panels that are formed to create those nutrient profiles and what's behind it. And with that lack of information, I could actually formulate very wrong in using raw and fresh food, not knowing how those profiles are created and what they're based on. So Chelsea and I think, go ahead.
Yeah, I want to jump in and discuss a little bit with this particular AAFCO meeting. There were a couple of things that went on regarding copper. I was in the laboratory meeting while you were in the kind of general regulatory meeting, and these things were happening at the same time, which I have noticed to be a trend, that those things often will occur simultaneously. So the lab and the regulators don't actually have an opportunity to see what's going on with others. Mm-hmm. And there are times when we're texting each other back and forth, and I'm in the lab meeting and I'm going, the lab says that this is horrible and they shouldn't be doing it, and they told them that. And then you're in the other room and you're texting, well, they're doing it and they're saying they talked to the lab and it's fine. So that kind of happened.
It does happen. It actually happened in this last meeting, and yeah. She's exactly right. So, even within an organization, they don't always agree, right? And so you do have like your laboratory scientific people who do the methodology for analyzing all these nutrients, as well as the microbiology side, and then you have the regulators and the feed control officials over here, and they don't always communicate very well. So Chelsea's exactly right. So not only just having one representative at the meeting, but having both Chelsea and I there, so she could be attending the laboratory, or I could be attending the laboratory, and vice versa, so we can share that information, is really important. So yeah, it is important to go. There's even though, like I said, it's really geared towards your commercial dry kibble diets, the fresh food sector is growing, and they need more representation. So we feel that as a responsible manufacturer, we need to show up to these and be there to represent the fresh and raw food manufacturers and community, and to be able to relay that information. So we appreciate you guys hearing us out today, and being able to kind of go over the not so fun stuff of food manufacturing and pet food regulations, but it is important. So going back to copper, they actually, so it's kind of like, a little bit of what's the topic of the year. So we were challenged with the DCM for a long time, right? And and that important topic very well, and a lot of pets did suffer from that. Well, the latest is a paper that was published by, I believe her name is Dr. Sharon Center, and she put I guess this is what started kind of the controversy. So, is it time to reconsider current guidelines for copper content in commercial dog food? And the reason she did this article or this paper is because she was seeing more copper storage disease in a lot of her patients. And obviously, one of the theories is that it's coming from food or overexposure to copper from these dogs. So I actually haven't seen the full paper yet. I need to completely read through it, but they talked about the highlights of it. And anyway, that's what's kind of why copper's in the forefront of the subjects on at the table at AAFCO this particular meeting. So they put together an expert panel that they often do this, and it's an outside panel that's some AAFCO members might be on the panel, but they ask people from all over the industry, veterinarians, PhDs, other researchers, to look into what this problem might be, and if they need to put a maximum for copper on in the OP official nutrient profiles, if they need to create a maximum level for pet food manufacturers to adhere to for copper.
And just to insert here,
go ahead.
This panel was actually put together a couple of years ago, so they've been working on this for a little while. Correct.
Yeah, this is something that has been in conversation for a while and has been working. So finally, after a couple of years of having this expert panel together, this particular meeting was like the summary. What did the panel come back to the pet food committee with? Like, what was their proposal? So I'm just going over some of my notes. So it's typical of AAFCO and typical of what we see often come back for a proposal. So the NRC, if you're not familiar with the NRC, it's the National Research Council. They every so many years would release their own expert opinions and a review, kind of like an OP that's for nutrient requirements for cats and dogs. So the last one published was 2006. So that's what we're all working off of. But since the 1970s, they've been publishing these, every so many years apart as they get the information and they can update it. So the NRC since 1979 has basically been the same for copper. It's about 15 parts per million of copper. That's a dry matter basis, okay, for you science geeks. That's just taking the water out. So that's without water. That kind of equates to 1.1 milligrams of copper. This would be as fed per 1,000 calories. That's on the low side, but not. I think that's where most of them agreed that you could set your minimum copper levels and be safe. So now it's the maximum ones that they're having a hard time with in their review. So basically they said that there was a maximum for copper historically prior to 2015. That was 300 parts per million was the maximum copper level, which equates to about 175 milligrams per 1,000 kCals. And this was extrapolated using swine diets. So this is from the diets of pigs. And a couple of the veterinarians that commented on this and said they, they weren't really thrilled with that because swine, obviously pigs, are omnivores. First of all, they're not carnivores, and they have different requirement needs, and they're also, livestock animals, so they're fed a little bit differently than our companion animals. So anyway, they took that off in 2015, but they didn't replace it with a maximum. They just eliminated it because they didn't feel that was appropriate, rather than trying to find an alternative.
And they did add in a note into the profile that basically said, there's a couple notes, but one of them says it's not that there isn't toxicity levels, like you just said, they do acknowledge that. It's just we're not sure what it is, so we're just not going to say anything about it. So most of the nutrients in the AAFCO book don't have a maximum. And what I think is really important to remember in regards to that is that, the development of regulation came along not for fresh food, but for like heat processed shelf stable foods. Everybody originally was making their own or getting their own in communities, and there wasn't mass access to these types of, fresh foods. And so regulation came along when they were like, oh, a lot of people are getting a hold of this, we need to make sure that it's safe. So everything was created really based on what does it look like if it's really heavily processed, how do we make sure that's safe. So the development of these regulations for pet foods was around kibble and canned foods, and then more recently raw foods and fresh food diets have come along, and they're like, let's just take this round peg of fresh food and jam it into the square hole of regulation, and let's just say that they're the same. Like they're not. So it's not really possible for them to adhere to the exact same regulation because they're not the same things.
Not at all.
Yeah, when it comes to toxicities with like a well absorbed diet like a fresh food, that's probably really important for you to take a look at, versus maybe toxicity isn't that big of an issue in a kibble diet because maybe they're absorbing 10% of the copper that you stick in there. But the point is, we need this research if we're telling people that that's the only thing that they should be feeding.
Absolutely. Right. It's kind of like you going to your pediatrician and him saying, well, if you feed Apple Jacks or an apple, it's the same thing. Right. Just Apple Jacks, an apple, they all got the nutrients in it. Just, Apple Jacks have fortified, synthetic vitamins, but same thing. So, you would raise an eyebrow if your pediatrician said, well, Apple Jacks, apple, it's all good, so very different, obviously, fresh foods. And then you're not going to have, part of the problem with vitamin and mineral toxicities is exactly that, in nature, typically, unless there was something that externally contaminated that area, which we do see, industrial contaminants that do contaminate areas where food is grown, and that could be a problem in the fresh food. But typically in fresh food that is not fortified, not overly processed, you're going to have a real hard time having toxicities in that food because the body just, there's nothing in there that's going to be so far out of balance in a natural food product, or the food wouldn't exist. The apple wouldn't grow if, copper was off the charts in it, or another mineral or something, where in food processing, obviously, it's man-made and mixed. So you're forcing nutrients into food that normally, wouldn't grow that way or be that way. Again, an animal, typically isn't going to grow with toxicities. Now, that being said, I would say something like feedlot cattle and what they're fed, could have problems with. That's why we don't use beef liver from feedlot cattle. Our beef liver comes from only grass-fed beef. That does make a difference. So, there are caveats to it, but basically in fresh food, it's going to be very difficult to get those types of toxicities.
And the toxicities are actually pretty well known when it comes to minerals like copper. In the AAFCO book, on around page 300, depending on which year you're looking at, they have the expected contaminant level of heavy metals on each individual mineral. Copper in particular is a little bit unique in the sense that, like, say, selenium, it's almost only going to be contaminated with mercury, but copper loves like every heavy metal, just all of them. It's like, just give me anything. So that one in particular, aside from the issue of copper itself potentially being a problem, you also increase the risk of heavy metal toxicity with high copper levels. In the laboratory meeting that I was in at this AAFCO meeting, they were discussing some of the issues that they have with testing the product. And one thing that was really interesting was they were saying it doesn't matter how well you stir your copper supplement in there, if it's an isolate, like you could stir it all day long, it will not homogenize, it's going to clump up. So they were showing on these test results, if they added in 10 milligrams of copper into a final product, they know exactly how much was in there when they created it. And one test would come back as saying that it had 4 mgs, and another test would come back and say that it had 20 mgs. And that's because, like, just like what would happen in your pet food with a synthetic, one bite might be a lot, bite might be none, and there's not really enough information to know if a really high copper intake on one day is going to store into the liver and cause any kind of damage, or if it's going to be okay over time. Like, we just don't know this because nature doesn't really do that.
Right. And that's a good segue into why most raw food manufacturers and fresh food feeders recommend rotation and variation. And I was saying to Chelsea earlier, as a nutritionist, that's one of your best insurance policies is variation too in your dog's diet. So even though we have a commercial raw food that we sell, I would still recommend rotating through several brands of high quality foods that you like for your pet. So maybe you identify your top 3 favorites and you rotate through those again. And it's not because any one manufacturer is doing anything wrong or deliberate or anything like that, but if you want that variation, so that again, especially with manufacturers that do use synthetics, we don't, in a lot of the higher a lot of the raw food manufacturers choose not to. But let's say you're not feeding a 100% fresh food diet, or you do need to require use some that do use synthetics, rotate through those other commercial brands, so that you do have less chance of maybe a manufacturer mistake or just an oversight, or that simple process of just homogenization. As much as you're a conscious manufacturer who takes the steps to do it right, there are certain ingredients, and like copper in this instance, that you just can't get a good and the lab even admitted it that Chelsea attended there. They're like, you just can't get good homogenation. So they had quite a range from 4 milligrams up until 20 when their target range was 10. Okay, and then on top of that, I'll add that you have limitations in the methodologies and analysis itself. So as a food scientist, I had to go through several semesters of food analysis classes. So we went through all the methodologies of not only the macronutrients, but finding these minerals. And they use lots of stuff called gas chromatography and spectrophotometry, and these high sophisticated type of instruments that find these minerals or these elements in their isolated form. Okay, but there's many limitations with these methodologies, and again, no fault of the lab, or you do have human error, of course, but you can only get so good at these methods and to analyze it down. So even within the lab itself, even if you're 10 milligrams was perfect and you tried to get it, you're still going to have variation show from one end of the spectrum to the other in your lab analysis. It's just, that's just where we are. The nature of food analysis is one of the most difficult parts of chemistry to really dial in, especially with fresh foods.
Yeah. And one other thing that they did mention in this laboratory meeting came down to just they had created this sample with the intention of making it absolutely identical and sending it out to multiple different labs in order to try and see if they could get the same results. And they didn't give any of the labs any direction on what to do. They just said, I want you to test for the following things. They didn't tell them how to do it. So every lab had the freedom to finalize the testing in whatever way that they chose to do that. So some of the labs decided to split the sample. Some of the labs decided to use, this type of machine versus that type of machine. There were just a variety of different things. And they were noting in this meeting that there was a lot of variance, not because the sample was any different, but because the way that each individual lab decided to use the sample was a little bit different, which, going a little bit away from copper, they had pointed out the importance of using a whole sample, because say that you have a mold, an aflatoxin that's in a sample, and you split the sample and you're only testing half of it, you might be like, oh yeah, it's negative for aflatoxins, but molds clump. So you might have taken out the important segment of the sample, but nobody's required to test an entire sample. And I've even heard, not in this meeting, but in previous meetings, I've heard them argue about how they have talked with the regulators, like, we need bigger samples, and the regulators were like, that's pretty much too inconvenient, we don't want to give you bigger samples. And then I've even heard them say, if we were to get the size of samples with certain tests that we needed, we don't have machinery that's large enough to test that and get an accurate result. So like you said, it's not the fault of the lab, but the way that we have to work, because we just don't know enough, and not everybody is doing things the exact same thing. And there's just a lot of limitations in technology that we still have. We like to pretend that that's not true.
I know.
We know so much, but no, really.
We do like to pretend. And I think that's something that, when we go to these AAFCO meetings, we're reminded of, because we do get to sit through the laboratory meetings. We do get to hear the shortcomings of, basically the lab fussing at, this is what we got to work with, guys. We're giving you the best we can, versus the feed control officials that are out in the field going, well, this is as much sample as I could get you. And then on top of that, you still have the issue of expense and the cost of doing this. And, they're working within a budget. They can only hire so many lab professionals. They can only update their equipment so much. They can only run so many in triplicate and replicate them. And so that's where, again, you're like, yeah, if we did, got a 1 pound sample and we ran it 30 times through this, yeah, we're going to get a good average and we're going to get a good indication of that. But that just isn't practical from an expense standpoint and from a laboratory management standpoint. So it's always a trade-off. What's our biggest benefit for the least expense, and how can we find this? And there's a lot of shortcomings, and I don't want to sound like it's all a waste of time or that some of this isn't beneficial. I mean, it absolutely is. Any data collection that we can get and improving methodologies, but we got a long way to go, folks. And so I just don't want consumers to be under the impression that these are absolutes, or that we've got this perfectly down. And don't get too hung up on the numbers, guys. Like, as much as nutrient profiles are important, and I'm not shirking the responsibilities of manufacturers to know what's in their food and to do that, it is important. But at the same time, I think it's really important to remember that that's a snapshot in time. Okay, so that one nutrient profile that manufacturer got from a lab is a snapshot in time of one batch, of one small sample of it. And again, I'm not saying that it's not going to represent the basics of their formulas and stuff. It should be a decent representative, But it's important to understand the big picture, that you got to remember, out in the wild and out in nature, it was variation, it was variety, it was often a lot of fasting, and then a lot of consuming of nutrients at one time. Our animals just aren't, they don't have that type of diet anymore. So it's key. It's really important that we stick with the fresh foods. We try to avoid as much of the processed stuff that we can, and the synthetics. And I think, again, that's your best insurance policy, that you're not going to create deficiencies or toxicities in your dog. And having that variation and rotation, just like we're supposed to eat seasonally, right? As human beings, we're hunter gatherers, and we would move across different plains and different forests and so we would cycle through our food. But so at one particular time, maybe what we were eating at that time wasn't the RDA, the recommended daily allowance of this nutrient, but we only did that for a month, and then we moved on to something else, or something else was in season and we ate that and we made up for it. So over a broad time period, all of our nutrients were met, but they might not be met in that one little snapshot. But because we had a variation, and we varied our food, and we rotated, and we ate stuff seasonally, over the big picture, we met all our nutrient needs. And so that's all I'm saying, is that don't get hung up on these numbers, guys. Like, if you are a fresh food feeder and you give your dog a wide variety of very nutrient dense foods, you should be hitting everything you need.
Yeah, and we definitely, we live that belief. Like, we feel like we don't have to know everything, because we know that nature knows everything. And if we just utilize the best of nature, then we're going to be making good products. So to give an analogy, nature can have a mountain, and because nature understands how to build a tall structure, that mountain's not just going to fall over. Whereas when you isolate something, it's kind of like building a skyscraper. You have to have a lot of precision and understanding to keep that thing from just falling over. The tiniest little mistake can end up being a really serious problem. So what ultimately this is summarizing is, even the people that are doing all of this science, even the people that know the most and make their entire life about doing this, are clearly saying we don't have enough information. So in our opinion, they shouldn't be building skyscrapers. They should settle a little bit more on accepting that whole food is going to be safer and covering a lot more bases that we don't even know about yet. Like, humans just don't understand a lot of the symbiotic requirements of what's going on in a food product. And so that's why we do what we do.
That is right. That's right. But we never stop trying to learn. We never stop trying to do better. And I think too, the splitting that time between, again, just the in vitro, which is in the lab, in the test tube, and in vivo, in the animal itself, in the human being itself, having those clinical trials versus what they do in the laboratory, and marrying those two also is important. And like I said, a lot of these papers that you'll read, there's so much done in the lab that has to be be able to be translated over to the human side, and a lot gets lost in translation and never makes it over, and never really reproduces itself from being reproduced in the lab to actually being reproduced in the animal's body itself. And so these are all things that play into the field of science, that we really have to make sure that we can wade through that information, and what's useful and what might not be so useful. So in the end, the expert copper panel that deliberated on this for, I guess, a year or more, basically said that use what the NRC has is good for the minimums. And sorry, this actually came from one of the FDA folks, Dr. Burkholder, who holds a membership and position on the Pet Food Committee, says they need to have more hard data rather than making an arbitrary guess at the maximum copper levels.
So
So
no
there's
max.
there's your professional conclusion from Dr. Burkholder from the
So
FDA.
if 300 parts per million is considered toxic in swine and your pet food company puts in 1,500, nobody's going to regulate that because there's not a maximum. So,
Yep.
all right. Well, that was
Buyer beware.
awesome. And exactly.
Are we out of time?
Yeah. Well,
Okay.
we've got so many other good topics. So
We do. We'll have to come back another time with more topics on it, but hopefully that summed it up for you guys. Copper storage disease, I think, Chelsea, would you say, still on the rare side, still not something that's really prolific in the pet food community. So, I don't know that anybody has to be really fearful, but do watch your levels of copper. Ask your manufacturers, what they are using, if it's a synthetic. One of the other things that the panel did propose, but I don't think that AAFCO accepted it, but they said that the forms of copper should only be copper oxide, and any other form of copper should be banned for use in pet food. Well, again, I don't think they took that advice from, but there you go, folks. So if you are looking at your ingredient statement on your pet food and they are using synthetics, see if it's copper oxide. If it's something else, maybe you want to beware, because that is something the expert panel said that should only be copper oxide for the form of copper in your dog food or pet food.
But it's too much trouble to change that right now. So there, just to be clear, they did not say that, like, despite knowing that, they did not say that there are any changes in what people are allowed to use. They can still choose to use whatever they want. So it's not like in the future there's going to be a limitation and you won't have to look out for it. You still need to look out to make sure that you know what they're using. So, all right. Well, on to the next one, everybody. See you next time.